The interior of the brain, it contains a series of cavities. These are known as the ventricles. Now the cerebrum, it contains a median cavity that is known as third ventricle, and the two lateral ventricles, these are present in each cerebral hemisphere. Now each lateral ventricle, it opens into the third ventricle through the interventricular foramen. The third ventricle, it communicates with the fourth ventricle through the cerebral aqueduct, while the fourth ventricle, it communicates with that of the subarachnoid space through the central canal. Now this entire ventricular system, it is lined by an epithelial layer that is known as ependyma. Now in last lecture we had seen the details of the fourth ventricle. Today we are going to see the details of the lateral ventricle. So objectives of today's lecture are: we have to see the location of the lateral ventricle in different parts, relations of it, and the applied anatomy of the lateral ventricle. Now this is the anterior view where you can see the two lateral ventricles in each cerebral hemisphere. Now each lateral ventricle is communicating with that of the third ventricle through the interventricular foramen, and through the third ventricle it communicates with the fourth ventricle through the cerebral aqueduct, and through the fourth ventricle it communicates with that of the central canal. Now this is the lateral view where the different parts of the lateral ventricles are seen. Now this is the central part of it. Its anterior extension, this is known as anterior horn. Its posterior extension, this is known as the posterior horn of it. And downwards and forwards in the temporal lobe, this is the inferior horn of the lateral ventricle. Now the lateral ventricle, these are two cavities, one situated in each cerebral hemisphere. This is the central part of the lateral ventricle. This is its anterior extension, this is known as anterior horn. This is the posterior extension of it, this is known as posterior horn. While downwards and forwards, this is the inferior horn of the lateral ventricle. This is a median sagittal section of the brain where you can see the relation of the lateral ventricle, that is the different parts of the corpus callosum. This is the rostrum, this is genu of the corpus callosum, this is body of the corpus callosum, and this is the splenium part of the corpus callosum. This is the fornix which is coming into the relation of the lateral ventricle, and this is the septum pellucidum which is present in between the two lateral ventricles, medial wall of it. Now this is interventricular foramen through which the lateral ventricle is communicating with that of the third ventricle. Now from the third ventricle it communicates with the fourth ventricle through the cerebral aqueduct, and this is the fourth ventricle which we had seen in the previous lecture, and it is communicating with that of the central canal of the spinal cord. And here you can see the foramen of Majetti. Now again, this is the lateral view of the lateral ventricle where the different parts are seen. This is the central part of it, which is extending from that of the interventricular foramen to the splenium part of the corpus callosum. Now the anterior extension of it into the frontal lobe, this is the anterior horn. Now this is the posterior horn of it from the posterior part of the central part extending into the occipital lobe. This is the posterior horn of it, and downwards and forwards from the posterior part of the central part. This is the inferior horn of the lateral ventricle. Moving on to the relations of each and every part of the lateral ventricle. Now first we'll see the central part or the body of the lateral ventricle. Now when you see it, it is elongated antero-posteriorly, and in a cross section it is seen as a triangular area. Now anteriorly, the central part of the body is continuous with that of the anterior part of the lateral ventricle, that is the anterior horn and the interventricular foramen. Posteriorly, the central part reaches the splenium of the corpus callosum. Now when you take a cross section of it, it is somewhat triangular and it is having a roof, a floor and a median wall. The roof is formed by the trunk of the corpus callosum. The medial wall of it is formed by the septum pellucidum and the body of the fornix. Now this medial wall is common to both ventricles. Floor of it is formed medially by the thalamus, while laterally it is related with the body of the caudate nucleus. In between the thalamus and the body of the caudate nucleus, laterally there lies the stria terminalis, while medially there is thalamostriate vein. Now in between the fornix and the upper part of the thalamus, there lies a choroid fissure. Now, a fold of the pia mater, that is the tela choroidea, it invaginates into the ventricle through this choroid fissure and covers the part of the thalamus. Now, this tela choroidea, it is common to both lateral ventricles and a third ventricle. Now, when you see the lateral edge of this tela choroidea, there are the plexuses of the blood vessels that constitute the choroid plexus. And this tela choroidea and other structures forming the walls of the ventricles, these are lined by the ependyma. Now, the choroid plexuses, they are highly vascular structures responsible for the production of the cerebrospinal fluid. And the surface of each plexus is lined by a membrane which is formed by fusion of the ventricular ependyma and the pia mater of the tela choroidea. So this is for the body of the lateral ventricle and its relations. The anterior horn of the lateral ventricle, it lies anterior to an imaginary line passing through that of the interventricular foramen. This horn is triangular in section and it is having a roof, a floor and a medial wall. And it is closed anteriorly by the genu and the rostrum of the corpus callosum. The roof of it is formed by the most anterior part of the trunk of the corpus callosum. The floor of it is formed by the head of the caudate nucleus and small part of the floor near the midline is formed by the upper surface of the rostrum of the corpus callosum. Medial wall is common to both sides and it is formed by the septum pellucidum. It may be noted that the telachoroidea and the choroid plexus they don't extend into this anterior horn. The posterior horn it extends backward and somewhat medially within the occipital lobe for a variable distance. Now this part is having the roof and the lateral wall and a medial wall of it. The roof and the lateral wall they form a continuous convex surface and the fibers of the optic radiation they pass along this surface separated by the fibers of the tapetum extending from that of the corpus callosum. The medial wall and the floor of the posterior horn they are continuous and they exhibit two elongations. These are known as the upper elevation is known as the posterior horn, bulb of the posterior horn. Now this is produced by the fibers of the forceps major which pass through that of the splenium of the corpus callosum. The lower elevation this is known as calcar aves and this is formed by the inward projection of the calcarine sulcus. So this is calcar aves which is formed by the inward projection of the calcarine sulcus. Moving on to the inferior horn of the lateral ventricle. It is the longest of the three and it first extends backward and laterally around the pulvinar of the thalamus and thereafter it proceeds downward and forward within the temporal lobe, lying deep and parallel with the superior temporal sulcus. And this is extends about 2.5 centimeters behind that of the temporal pole. Now this inferior horn it presents a roof and a floor. Now when you see the roof of it, the roof is formed in the lateral part by the tapetum of the corpus callosum. The medial part of the roof it presents the tail of the caudate nucleus and the stria terminalis. Now the stria terminalis these are form a projection or a bundle of that of the amygdaloid body. Now the floor of the lateral ventricle presents from lateral to medial side the collateral eminence. This collateral eminence is an elongated elevation which is formed by inward projection of the collateral sulcus. This is formed by the inward projection of the collateral sulcus. Now this posterior part of this eminence it forms a flattened collateral trigone at the junction of the floor of the posterior and the inferior horns. So, a collateral trigone is seen at the junction of the posterior and the inferior horns. Now, the hippocampus, this is also a prominent longitudinal elevation medial to that of the collateral eminence. This belongs to the limbic system and presents and enlarged anterior end with the oblique grooves, which resembles an animal's paw that is known as base hippocampi. Now, the fibers derived from the hippocampus, they form a thin sheet of white matter that is known as alveus, and this alveus it converges backwards and medially to form fimbria, which is continuous with the crust of the fornix below the splenium. The most medially here lies the choroid plexus, which extends into the inferior horn through the choroid fissure. So this is the floor of the inferior horn of the lateral ventricle. So roof is formed by that of the tapetum laterally. Medially there is tail of the caudate nucleus and the stria terminalis. While in the floor you are having the collateral eminence, the hippocampus, the alveus which is lining that of the hippocampus, then it converges medially backwards to form the fimbria, and the choroid plexus is lying into the floor. Moving on to the applied anatomy of these ventricles. Ventriculography, where the ventricles can be studied in the living subjects by taking radiographs of the ventricles after injecting a radiopaque dye into the ventricular system, and the procedure is known as ventriculography, where the parts of that ventricles can be seen. Now today in modern technology it can be seen by the modern techniques like the computed tomography and that of the magnetic resonance imaging, that are the MRI scans. Moving on to the condition known as hydrocephalus, where due to abnormal increase in the CSF, there is enlargement of the head in the children, and this condition it is known as hydrocephalus. Now the abnormal pressure of the cerebrospinal fluid, it leads to the degeneration of the brain tissue. The hydrocephalus might occur because of the excess production of the CSF, or there is obstruction to the outflow of the CSF, or there is impaired absorption of the CSF through the arachnoid villi. It is classified as obstructive or communicating. In obstructive type, there is obstruction is present in the ventricular system, where the CSF has to pass through a narrow aperture. Now these are the apertures of the fourth ventricle, the interventricular foramina and the aqueduct of the Sylvius. While in communicating type of the hydrocephalus, such obstruction is not present. Now in each of the above instances, the dilatation is confirmed proximal to that of the obstruction. Sometimes meningitis may lead to obstruction between the tentorium cerebelli and that of the brainstem, and this may also lead to the hydrocephalus by affecting the arachnoid villi, thus hampering the reabsorption of the CSF. Just to summarize, we had seen the location of the lateral ventricles, its different parts, their relations, and the applied aspect of the lateral ventricle. Thank you.